No more Crohn's disease. Crohn's disease is an inflammatory bowel disease, a chronic inflammation that typically affects the lower small intestine, large intestine, or both, and can affect any part of the digestive tract. Typical symptoms include chronic diarrhea, sometimes bloody, cramping abdominal pain, fever, decreased appetite, and weight loss. The most common sites of Crohn's disease are the terminal small intestine, ileum, and large intestine, but it can occur anywhere along the digestive tract from the mouth to the anus, and even in the skin around the anus. Inflammation of the ileum is called ileitis. When Crohn's disease affects the colon, it is called Crohn's colitis. Unlike the rectum, which is usually not affected, ulcerative colitis always involves the rectum. However, perianal infections and other complications are not uncommon. The most common symptoms of Crohn's disease are crampy abdominal pain, chronic diarrhea, sometimes bloody diarrhea if the large intestine is severely affected, fever, loss of appetite, less common, weight loss. Symptoms of Crohn's disease may last for days or weeks or may resolve on their own. It is rare for a first attack to go into complete remission without recurrence. Crohn's disease almost always occurs at irregular intervals throughout the patient's life. Attacks may be mild or severe, brief or long-lasting. Severe attacks may cause severe abdominal pain, dehydration and gastrointestinal bleeding. It's still unclear why Crohn's disease waxes and wanes, what causes it to flare up, or what factors are related to the severity of the disease. Recurrent inflammation often occurs in the same areas of the intestine. It may also appear near a diseased segment of bowel that has been surgically removed. Complications of Crohn's disease include intestinal blockage, obstruction, intestinal perforation, rupture, abdominal abscess, purulent infection, fistula, abnormal connecting passage between the intestine and the skin or other organs, anal fissure, anal skin tears, and anal abscess, colon cancer, large bowel cancer. Toxic colitis is a rare complication that can occur when Crohn's disease affects the large intestine, colon. The large intestine stops contracting and expanding normally, sometimes leading to peritonitis. The patient may need surgery. Scarring caused by chronic inflammation can lead to intestinal obstruction. Deep ulcers that penetrate the intestinal wall can form abscesses, open fistulas, or perforations. A fistula can connect two different parts of the intestine. Fistulas can also penetrate the bowel and bladder or the bowel and the surface of the skin, especially the perianal skin. Although fistulas between the small intestine are common, intestinal perforation is rare. Anal skin tears are common. Rectal bleeding often occurs when the large intestine is extensively affected by Crohn's disease. After years of having Crohn's colitis, people are at increased risk of developing colon cancer, colorectal cancer. About 1/3 of patients with Crohn's disease have perianal lesions, especially anal fistulas and anal fissures. Crohn's disease can also cause complications in other parts of the body. These complications include gallstones, insufficient absorption of nutrients, malabsorption, urinary tract infections, kidney stones, amyloid protein deposits in several organs, amyloidosis. When Crohn's disease causes flare-ups of gastrointestinal symptoms, patients may also develop the following conditions: arthritis, inflammation of the whites of the eyes, superficial scleritis, mouth ulcers, aphthous stomatitis. Inflammatory skin nodules, erythema nodosum, on the arms and legs. Even if Crohn's disease does not cause an episode of gastrointestinal symptoms, a person may still have the following conditions that are completely unrelated to the gut: inflammation of the spine, ankylosing spondylitis; pelvic joint inflammation, sacroiliitis; inflammation of the eye, uveitis; inflammation of the bile ducts, primary sclerosing cholangitis; purple skin acne that may contain pus, pyoderma gangrenosum;